Hi, I'm Dr. Faisel Syed. Welcome to another episode of Faisel Friends. We're here because we believe everyone deserves access to quality primary care, and ChenMed needs physicians to take care of them. Tonight's topic is COVID update. My co-host and moderator of the chat is Dr. Dan McCarter. Welcome, Dr. Dan.
Hey, Faisel. It's good to be here for the final episode of the year.
I know. Can you believe it? I can't believe it. How are you doing tonight?
I'm doing well. I know that there's a lot of concern about COVID. I'm going to view to see the glass as half full instead of half empty, but we'll have to see what our guest thinks tonight.
Well, I turn to you for all the issues in my life because of the way you always view things with the glass half full. Let's welcome our friend for the evening, Dr. Jason Lane. Jason, welcome.
Hi, Faisel. Hi, Dan. Great to see you guys again. Great to be here.
It's so good to have you back on. You know, when we had first reached out to you about joining us tonight, we had the idea of having this victory lap episode with COVID. You know, we're going into the holiday season, and then we get hit with this Omicron. So for people who are confused with so much information out, could you give us a quick, brief explanation around the name, this Omicron? What do we know about this?
Yeah, so the name just comes from the naming convention the WHO is using. They're using the Greek alphabet. They've skipped a few, and when this variant of concern came up, they were down to Omicron. What was interesting about this one is they named it a variant of concern very quickly. So usually it takes a while in between identifying a new variant of COVID and then determining that it's concerning. This one, South Africa has a really robust genetic surveillance program. And so they learned a lot about this one very quickly. And so we knew right away that it had all of these genetic changes that could be a problem. We didn't know it would be a problem, but we knew it could be a problem. So they came right out almost immediately and said, this one's concerning. And what that did was it got the news cycle on top of it before we really knew very much. And so there were huge headlines about this the day after Thanksgiving, just as we're all waking up from our turkey and stuffing comas, about this really scary new thing. It almost sounded like, 2 years ago when the whole thing started. But in reality, we knew that there were some reasons to be concerned, but we had no idea if any of those were going to come to be true. So, fast forward a couple of weeks, we're here now. We've learned a little bit more. We've learned that some of those concerns were true, but we also still have a lot to learn before we know, what the impact is really going to be.
Do we know if it's more contagious? What do we know about the disease illness from it itself?
Yeah. So the major concern was that it would spread more easily. And I think at this point, we can say the answer to that is yes. And the reason is everywhere that it's been circulating for a while, for at least a couple of weeks since it's been identified, it's really started to overtake the other types of coronavirus that were circulating. So it overtook Delta in South Africa. It's overtaking Delta in England. Other parts of Europe are predicting it's going to overtake it pretty quickly. And I just read some information that it's spreading really quickly in the state of Washington right now. So that concern about it being more contagious, it looks like that's true. The next concern, which is looking to probably be true, is that it's more likely to evade the immune system, right? So that leads to two things. It means it's more likely to reinfect you if you've been infected from COVID before. And it also means it's more likely to cause a vaccine breakthrough infection, which is unfortunate. And it sounds exhausting to me to worry that, oh no, does that mean these vaccines aren't working? But hold on there. The good news is I think this will be kind of a similar story that we had with Delta over the summer. I think, right? I'm venturing out into some uncertainty here, but I think what we're going to find is, yes, it's more likely to cause, perhaps a mild infection in someone who's fully vaccinated, but the vaccines are probably going to hold up well to keep you from getting a severe infection and keep you out of the hospital, especially if you've gotten a booster. So this thing's moving so fast that we're learning more every day, but it's pointing in that direction, which is actually, a pretty good place to be, especially compared to where we were, 18 months ago.
Exactly. I think about where we were even a year ago, and the context of things with with us getting vaccinated, with our older children getting vaccinated, and now with our younger children getting vaccinated. Although it's so frustrating, I do feel like we are so much more prepared now compared to where we were even when we were first learning about Delta.
Yeah, when these vaccines came out, the effectiveness that was reported, especially with Pfizer and Moderna, was just bordering on miraculous. And I think back to that because I think the first Pfizer shot was given just a couple days over a year ago now, and a lot of us thought that they were going to end the pandemic, right? It would be over by now. But because of some of what's developed, both with vaccine hesitancy and also with some of these variants that don't respond quite as well to the vaccine, we are dealing with it for a longer period of time than we thought we would at this time a year ago. But the vaccines are holding up really well in making everything a lot, for lack of a better term, less bad, right? So myself being fully vaccinated, and I chose to get out and get a booster too as soon as I was eligible. I'm not worried about going to the gym right now. I'm not worried about going to restaurants. Now, I'm in South Florida where there's not much COVID around right now, thankfully. We got through our summer wave. If COVID gets really bad down here, again, I might rethink those things and pull back for a couple of weeks. But I have a lot more room to operate without fear, right, than I did, and just in my regular life, than I did, say, the summer of 2020 and moving into when the vaccines were finally available.
Yeah, I see like just from the population of people, especially who are vaccinated, like I'm seeing incredible resilience with the flexibility of how we are trying to move on with our lives, even with meetings, with people getting together at conferences and things, with showing the proof of their vaccination, with wearing masks whenever possible. I mean, it's keeping the safe distances apart from one another, having reduced amount of attendance and all that. Um, and if we have to, like you said, like even with going to the gym or doing some of the things that we've all started getting a little bit more relaxed with, if we had to pull back, what's the big deal about pulling back for a couple weeks?
Yeah. So, like, over the summer when Delta hit, I still remember the day I realized that it was more of a problem than I thought it was going to be, right? Because I was still operating in the December 2020 mindset where, hey, these vaccines essentially took away almost all the risk. And, I've been reading about increased breakthrough infections with Delta, but I hadn't really been seeing it. And the day that I realized it was a problem, I was at my desk at our corporate office, and I saw a bunch of the young analysts who worked there. We'd been maskless for a while and everybody loved it. But all of a sudden I looked up and I saw 5 or 6 of our analysts running for the door with masks on. I'm like, uh-oh.
Uh-oh.
Wonder what happened. And it turns out, one of their colleagues who was fully vaccinated had a breakthrough infection. They were all in a meeting together and they found out, and everyone was, rightfully really concerned. And right around that time, we started to see a lot of breakthrough infections in our patients. And clearly I learned, the risk is more than we had been used to as you were vaccinated. But, I think if you were keeping track of the community spread and stuff, it was very possible to identify when the risk was greater in your area and pull back a little bit from some of the more risky stuff. And then as that risk went back down, go back to life that was a little bit more normal. And, it could be that with the Omicron wave and, I hope not, but maybe one after that, we don't know. That might be the way we deal with it for a little while until things, completely calm down, to pre-COVID times.
I think it's important to talk about what we know about the protection that these vaccines offer to us. Even if you do catch the virus, like what's the protection that we can expect with Delta and even with Omicron, at least with what we know?